So our speaker for today is Dr. Linda Nyamute. Linda did her MBCHB in University of Nairobi, completed in 2014, and did her MMed in psychiatry in the same university and completed in 2019. She's the head of mental health department at Jaramogi Odinga Teaching and Referral Hospital. She's a member of Mental Health Council in Kisumu. She's also a National Executive Council member of Kenya Psychiatric Association, where she serves as head of Committee for Advocacy and Awards. She's also a lecturer at Uzima University. Linda is a founder of Mental Sphere, which is a nonprofit organization with a primary mandate to create awareness on mental health and provide holistic mental health care. She enjoys working with young adults and adolescents and has partnered with many organizations to promote mental health wellness. So I'll invite, welcome, Linda.
Good morning. Thank you for the introduction. Yes, as said, sometimes when you hear people talk about you, you wonder whether it's you. But yeah, I think that we get straight to the point. If you may allow me, I can start the presentation.
Yes, go ahead.
Right, so our discussion today, this morning, is on stress and depression among healthcare workers. So just to start off, as we know, health, the definition of health according to the World Health Organization, health is your physical, mental, and social well-being, and it's not merely the absence of disease. So just because you don't have a diagnosable illness or a diagnosable disorder doesn't mean that you are necessarily healthy. Mental health, on the other hand, because as we see, mental health is part of the definition of health. Mental health is when you're also able to, other than your thinking, feeling, and behavior aspect, also you need to be in a space where you realize your potential, you're able to cope with normal stress, which is part of our discussion today, and work productively within the environment that you're working in, and you're able to contribute to the community that you yourself are in, whether it's at home or whether it's in your workplace. So the different mental states. We have mental wellness, which is what we have described in the previous slide. You're able to contribute significantly to your community, you're able to work productively. Yes, and when we have significant stresses, and of course, life as it is, you'll have from time to time, there'll be challenges that life will throw at you. So at times you can be in a state of psychological distress. What's important is to be able to notice when you're in that space so that it doesn't lead to now the other extreme, which is now mental illness or a mental disorder. So with the mental health, sometimes you don't necessarily have to have a diagnosable illness for you to say that there's something wrong with your mental health. So there's poor mental health, which is very different from a mental illness. Poor mental health, maybe you don't necessarily meet the criteria that we use to diagnose a mental illness, but of course we can tell that there's something not quite right. Then of course, now when you go to the parameters that we look at when you're talking about mental health, we have matters to do with sleep, which is a lot when it comes to healthcare workers. This is really a very big area of concern. A lot of us, maybe due to our shifts, due to workload, we find ourselves having either irregular sleep or reduced hours of sleep, probably to keep up with the shifts, to keep up with other shifts, probably because of how they are arranged, or maybe you want to do extra shifts, probably for the extra pay. But yes, for a lot of healthcare workers, you do find sleep is really an area of concern. The mood, a lot of us end up having very irritable mood, and especially when we have matters to do with burnout. So the mood, emotions, and the attitude. When you ask the public sometimes what they think about doctors, nurses, and there's usually this perception. I think all of us should actually just go online and just check what is the perception of the public towards the attitude they get from healthcare workers. It's quite interesting. And sometimes we retaliate and think these people are just being insensitive, but sometimes it's actually true. If you yourself are on the other side as a patient and you find a healthcare worker who's probably sleep deprived, underpaid, their emotions, their attitude towards you may not be that quite receptive. Yet this is probably someone who does not have a diagnosable or does not have a diagnosis of a mental illness, but clearly there's something off. So other parameters, memory, concentration, attention, their energy levels, how your relationships are with your family members, intimate relationships with the children, all that aspect, the motivation to work, and your general behavior. So all these are parameters that can give us quite some insight as to whether you have good mental health, poor mental health, or actually have a mental disorder. So locally, among healthcare workers, this is research that has been done in our population. There's a research done around the time for COVID, where we were having significant problems among healthcare workers, especially being frontline. And, there was so much anxiety in COVID. It was this whole new concept and all that. However, this was a research done at that time. Among the healthcare workers, we had quite a high prevalence, much higher than the general population. Shows 32%, general anxiety as well, 36%, 24% had insomnia. And of course, depression, as I think same with the general population, was higher among the females compared to the males. And workers younger than 35 years of age were, of course, found to be more depressed than those who are much older, and those who are not married, single people were found to have higher prevalence, significantly higher prevalence than those who were married. So this is a study that was done by Dr. Koba et al. You could have a look at it as well later. However, it's important to note that as healthcare workers, there are things that put us at more risk to developing stress and other mental illnesses compared to the general population. Of course, it doesn't mean that the other professions are protective. Of course, they also have their own significant stresses, but for healthcare workers, there are particular issues associated with our profession that we need to be on the lookout for, that put us at an increased risk of developing mental illnesses. A different research, but still done in Kenya, showed we have like 35.8% of healthcare workers have had at least once lifetime use of alcohol. And that's quite a significant number, because we know with healthcare workers, there's a very high risk to go into addiction, especially when we do not know how to manage our stresses adequately. So the poor coping styles for some people may end up being alcohol and other drug use. So the topic of the day, stress. Stress is basically just an emotional strain and pressure on one's self, especially the psychological self. So there's positive stress. Positive stress is basically when when the emotional stress is emotional pressure or emotional strain is able to motivate you to do more. You have a deadline at work. It motivates you to to complete the project that you are supposed to complete. If you're in school and you have to do your dissertation, for example, there's that deadline that's, we have to submit our presentations by maybe end of March, and it motivates you to work harder and actually complete your research. It also helps you to focus your energy and attention, focus, yes, your concentration, and you're able now to sit down and actually have your work going. Of note is positive stress is usually short-term. It should not be prolonged. So as you said, like if it's a dissertation, it should not be something that keeps stressing you month in, month out. And then the 2023 has ended, 2024 has ended, you still have the same stress. It stops becoming a positive stress. It actually starts becoming distress. So positive stress naturally will increase performance. Distress, on the other hand, causes anxiety, makes you feel very unpleasant. Of course, it will decrease performance. Distress sometimes can be short-term, especially if the stress is overwhelming, or if it's prolonged. Of course, as you said, if stress is prolonged, it can be a sign of distress. So just looking at this stress curve, so on the x-axis, yes, as it's called, is the stress level. So as you can see, this is from too little stress to extreme stress. And then, of course, on the y-axis is performance. So this is generally for how we as human beings naturally respond to stress matters, our performance. So when there's too little stress, what we call underload, you see there's inactivity, you're not motivated, you're not moved, you just are, yeah. And then there's what you call the optimum stress, which is this area around here, where now you're able to, as you can see the graph, you're able to function optimally. However, once you get to this peak, anything much stress further than that becomes toxic, and now there's the issue to do with exhaustion. And once we get to this extreme stress, we can get to burnout. Just in line with the same, what we're just talking about, still the same curve. See how this can now interfere with, or rather interact with the other aspects of your mental health. So too little stress gives you a neutral or a passive mood. When it comes to sleep, you're always just lethargic, tired. You're always constantly sleepy. You're unaware of important events. You're not in control of basically what is happening around you. You just are. When it comes to decision making, you're really involved in anything. Then, of course, on the extreme end, when it comes to mood, once you have burnout, and for a lot of healthcare workers, medics, nurses, etc., we have a lot of healthcare workers who have burnout and they do not recognize it until it's too late. So part of the things you can know is now when your mood start becoming very irritable, and many of us are usually irritable, looking at where I work and some of my colleagues find they're very irritable and always irritable, and you do not know why. Okay, some it's just their baseline attitude or baseline personality, but some it could also be due to extreme stress and burnout, employee burnout. Yes, so sleep, find either you have very disrupted sleep or difficulty sleeping, insomnia. Sometimes you have sleep where you sleep, you wake up, you feel still very lethargic, you feel you're not rested, you still want to sleep. That is really also a sign of burnout. Then you are also, you struggle, you find yourself struggling to keep up with important events in your life. You struggle to keep up with dates, meetings that are important or significant to you and to the people around you. It also can give you an area where you're now disinterested now completely in other things. So now you also end up being in the same in the same area with the person who has very little stress, where you're also disinterested, but not because you don't have anything pushing you, but it's because it's too much that you no longer now want to be part of anything further, because your brain is physically, I mean, your brain is drained, basically. Yes. So, burnout was not part of the conversation, but you can't talk about stress without talking about burnout. And again, as you mentioned, burnout is very common, very prevalent rather, among healthcare workers. So symptoms or how you'd recognize that you or your colleague has burnout would be, you feel very overwhelmed. Simple task. There's this joke we like saying, I'm already tired tomorrow. Like, you're going to work, it's Sunday evening, you're looking at Monday and you're like, oh my God, I'm already tired, because you're already feeling overwhelmed even before you get to work, because you have burnout. Nothing, it's just exhausting. Yes, very fatigued. Then, of course, the mood changes. Irritability is really very common. Feel very frustrated with even small things. You find very little things are triggering you. You've left your pen on the desk, someone picks it, and you get so upset, and you vent, and you throw a tantrum at very small things. And this could be because you're actually burnt out. Loss of energy in doing your chores, in doing basic things, even your own personal day-to-day activities. Sleep disturbances, as we've mentioned, and especially the one where you sleep and you feel still very exhausted in the morning, like you've been farming or something the whole night. Appetite changes. This can go either way. It can be extreme hunger, you feel constantly you just want to eat all the time, or the exact opposite, where you lose appetite. Then we can have neither here, Hapakule syndrome, what you call that, headaches, muscle pain, back pain. Yes, because of the lethargy. So what happens now what's now becomes as a result of that is you have loss of motivation to go to work, you have poor decision making, you don't meet targets that you need to meet to be able to probably get a promotion or go to the next stage in life. Then there's absenteeism. There's also what we call presenteeism, where you're at work, you're there physically, but you're not really there. Yes, so that is mostly about burnout. So the extreme cases, we can now have depression, which is basically characterized by a sad and irritable mood that is sustained over a period of time. For us, usually give it a minimum of 2 weeks. And this mood is really for most days than not. So if for the week that has 7 days, at least 4 days, so more days than not. Just the persistent low mood, which can also interfere with your changes in sleep patterns. I think we see a similar pattern of things, or a similar symptomatology with these things when we talked about stress and distress, when we've talked about burnout, and now we're talking about depression. It's the same thing. Emotions, issues to do with sleep, issues to do with appetite. They keep recurring, and that's why we probably cannot separate these three conversations. So depression also has the element of hopelessness, inappropriate guilt, and sometimes in extreme cases, you find people contemplating suicide. And we have had cases of healthcare workers, the ones we clearly know of, and some probably the stories were not quite clear, but we do know of at least one person who has had an attempted suicide or actually a completed suicide. And it's usually quite a sad moment, because everyone comes out and starts saying, oh, why didn't they talk about it? Why didn't they say all these issues they had? Or even me, I've been in this situation. And sometimes it's very complex to understand depression, and especially from a colleague point of view, because sometimes you feel like probably they should have come and talked to me. But there's, we'll talk about why people don't open up, but suicidal ideation can also be, as the extreme severe symptom of depression. So other things, as we mentioned, poor concentration, a slowed movement, etc, etc. Again, the symptoms just keep repeating. So when it comes to healthcare workers, the stresses that usually face us that may be a bit different from the general population. We have our working hours, which sometimes can be very extensive. Remember when you were in internship, sometimes you'd work for 36 straight hours and you're still expected to be at your highest performance. Sometimes you'd find yourself, from experience, sometimes you'd find yourself blacking out on the desk. Like there's a day for me, I actually got woken up by the patient because I fell asleep on the desk. It's been, you did the night shift and then this is like 3 p.m. in the afternoon, you're still working from 8 a.m. the day before. And this is nothing new. I'm sure many of us have experienced such stuff. So our working hours sometimes can be very, very strenuous. The cost of training, and right now it's become quite strenuous on the financial aspect, especially. We also have the cost of training, the physical torture it has on your body, because as you said, you're supposed to be awake for all this amount of time, or rather cover these shifts for these prolonged periods of hours. So that of course has a physical impact has an impact on your physical self. Additionally, it also has an impact on your emotions. And that's where you find sometimes people become very disengaged with their colleagues, disengaged to their patients because of that constant emotional drain. Then, of course, another stressor, very important stressor, is employment. We are currently in a situation where we have trained personnel, but we don't have those spaces, or rather the employment opportunities for them to be absorbed in. They may be there, but the people who are responsible to ensure that people come on board are probably not quite coming up to announce or create those job opportunities, basically. So employment has become quite a significant stressor of late. Of course, in enumeration, I think this is a conversation that can go on and on about doctors' pay, nurses' pay, etc. Another stressor could be self-confidence and performance anxiety. And especially if you've been bullied by a senior before, or rather a senior has ridiculed you, or when you are doing a presentation in front of your colleagues, of course, this will now impact on your self-confidence and how you view yourself in front of the rest of your classmates or the rest of your co-workers. So it's usually very important for us as the fellow colleagues, or you as a senior, to make sure you're doing more of mentorship than bullying. I mean, let me just call it out as it is, bullying. So whenever someone does a mistake, there are ways in which you can correct them. There's how you can criticize someone. Of course, we don't say now that don't criticize anyone. We need that criticism to be better. But how you do it can deliver the same message and get a very different response based on how you approach the whole situation. Then another stressor is societal expectations and the stereotypes people have of doctors. You enter medical school year 2 and the people at home are already expecting you to send money, yet you've not even started working as that doctor. Or you've graduated your first job, you just even want to celebrate your, hard work. And there's already there's an aunt somewhere calling for school fees because they know you're a doctor, you have money and lots of money, I mean, it's, I usually complain how you go somewhere, and that's why I tend to ignore the prefix doctor whenever I'm in a lot of social setups, because the minute you say you're just expecting, you're rich, you'll pay for this, and you're rich, you give me money, it's just give me money. They have done nothing for you, but just give me money because you have a lot of it. So societal expectations of healthcare workers can also be quite a significant stressor. A stigma to mental health issues in the workplace, it's very difficult. It's easy for you to come and tell a colleague, I was diagnosed with diabetes, or I was diagnosed with a left hand fracture, something. It's very easy for us to open up about that and talk about that, and you'll even give details of how the admission was and how your doctor is. Even say you'll even find, if you meet someone, you meet your doctor, someone will say, oh, this is Dr. Karaoke, for example, this is Dr. Karaoke, my cardiologist, but no one will ever say this is Dr. Nyamute, my psychiatrist, because of that stigma that is there. We don't want to be seen or associated with mental health issues, and this poses as a big risk factor to poor health-seeking behavior, and becomes a reason why a lot of people go undiagnosed for years without getting the help that they need. So why are some people more prone to distress, or burnout, or depression? Because, I mean, we all are thrown into the same deep where you'll have this extra working hours, you'll have this underpayment or poor enumeration. We all have this thing, stresses, but why are some people more prone to distress or burnout? So we usually have what we call the predisposing factors. As we said, no, we didn't say it, but we'll say it now. Medics, healthcare workers are just our sample of the general population, okay? So the same way the general population would have these predisposing factors, there are these things which you're just naturally born with. Before you become a medic, you're human first. So there's the component of genetic vulnerability to some mental illnesses. If you had any toxic exposure when your mother was pregnant, any birth complications and the likes, then of course your attachment style and how you grew up with the caregivers around you, your personality traits, insecurities, fear, issues to do with trauma and growing up in violent environments. Then of course divorce and the likes. So these are already predisposing factors before you even are a healthcare worker. Then we have then we have what now we call precipitating factors. What triggers now you to getting psychological distress, for example? So things to do with poor sleep, for whatever reason you're just having poor sleep, not as a result, or could be also as a result of the shifts that you're doing, then you just have this poor sleep, or you have the substance misuse, or there's a recent loss or death, or you lose your job, some sort of loss. Then other stresses, school stresses, your supervisor has told you your dissertation is the worst they have ever seen and there's no way you'll graduate, and they keep frustrating you. of course, that could be a significant stressor too, developing distress and even burnout, even depression. Yeah, so other things outside work, relationships, also very important. Allow me to just plug my laptop, sorry. Yes, so now then we have perpetuating factors. Perpetuating factors is now, there's the precipitating factor and then there's this perpetuating factor. What keeps the situation or the distress, the depression from getting better? What enables it to continue? So things to, if you are being put on medication, so poor response to that medication, or you have another illness of some sort, that is on the biological side. On the social side, things to do with stigma, and you're unable to access treatment because you're scared of how people will perceive you, so you don't get treated. Then of course the illness gets worse and worse. So, sorry. So in a nutshell, this is just how it looks. Your predisposing factors here is just how we function. And then this is the threshold to developing, whether it's psychological distress or whether it's burnout or whether it's depression, there's a threshold. So this is still your predisposing. So this is just your baseline. This is what, so different people have different graphs when it comes to the predisposing element. Some people are much higher, some people will be much lower. And then of course there'll be the precipitating factor, which now can throw you over the threshold. And then you have the illness as it is. And then we have now the this is the precipitating factor. Then we have the perpetuating factor that now comes to enable the disease or the illness to continue over time. As you can see here, it becomes chronic. So yeah. So we've talked about all these issues, elements. How do we go about management of stress, distress, and depression? So early identification is key, very key. Sometimes it may be you who notices that there's an issue, there's a problem. Sometimes it may be your colleague at work. Sometimes it may be your family member who notices that, you know, there's something not quite right. However, early identification, not only for stress and depression, generally for many illnesses across the board, is usually better in terms of prognosis and management. So individually, things you can do, we have different options. Now it will depend on what exactly is wrong. So if it's mild, of course, the management will be different. If it's severe, the management will be different. But as an overview, there's the option of medication, there's the option of psychotherapy, rehabilitation services in case your stress has gotten so severe that now you've opted for alcohol or other drugs as a coping mechanism. So rehabilitation services. We have other physical treatments, some of which are a bit controversial. For example, the ECT, electroconvulsive therapy. But again, it will depend on what a person needs. Of course, the support groups. Sometimes a support group at work may be helpful. Sometimes it may be worsening the whole situation. Nonetheless, all this have to be weighed for different individuals. Then, of course, the employer has their part to play in terms of helping an employee to recover or rather seek treatment. Some people have put in wellness programs within the facility or have a clinic where the employee can seek help. But they depend. Some hospitals, you'll have a counselor seeing you. Sometimes it may be a bit strange because if let's say you're a senior obstetrician at the department, and then you've been referred to a colleague who responds to you. or rather is under you and has to respond to you. It will be very difficult for you to seek help in that aspect. So from that person. So the employer has to put measures in place in how the employees can still seek help in such cases. So ways to stay mentally healthy, I think some usually just sound like a song at this point. However, there are different aspects. We usually say it's more of a holistic approach, more like this. So there's the physical self-care, there's the personal self-care, there's the mental self-care, emotional, spiritual, and of course the professional self-care. So when it comes to the physical self-care, things to do with our diet, our sleep is very important. Exercising regularly, also very important. When it comes to our mental and spiritual side, you want to look at the aspects of journaling, meditation, yoga, because we recommend spirituality with or without religion, but spirituality is really the umbrella of all that. So ascribing to a higher power usually helps us to also, have something to look forward to, create that sense of hope. And as we know, with patients who have, or rather people who have contemplated suicide before, it's usually as a result of loss of hope. So having that hope, and whatever it is that gives you hope is usually very protective. And of course, when it comes to professional self-care, setting boundaries is really very important. You need to know to what point can I stretch? Because as we say, if you collapse at work and you're the only intern on the ground, you're the only resident on the ground, I mean, they'll get a replacement as soon as, before even your body is removed from that scene. They'll have already gotten someone to fill in the work that you're supposed to do. So you need to know how to set your boundaries, know your limits, and always remember to prioritize your self-care. So I think we've mentioned this already. When it comes to mental self-care, things you can do is like reading a book, solving a puzzle, engaging in self-compassion. These are usually very important also to prevent you from developing early dementia as well. So physical self-care, getting enough sleep, exercising, if you're on medication, taking your medication as it should be, emotional self-care, socialize. I mean, it becomes a bit, the emotional and social, especially for healthcare workers, we tend to only socialize with ourselves. Then when you're socializing with yourselves, you've met your friends for lunch who are the colleagues you work with, you see them every day, you meet for lunch, you talk about the same patients you treated yesterday, and you still talk about the work that you're going to do tomorrow. This doesn't help much. You need to socialize with probably a different group, whether it's your family or maybe a whole different group of friends that does not necessarily include your colleagues or people you are in the same profession, to also broaden your thinking, to broaden your perspective about life, and also expose you to other different aspects out there. Yes, and of course you said spiritual self-care, mindfulness session. Then we have this very interesting concept to talk about all the time. Initially, it was called the work-life balance, but we no longer use the term work-life balance, because when you talk about work-life balance, it's basically saying that one has to take precedence over the other, or you take from this to add to this. So that doesn't necessarily have to be the case. We now are moving towards what we call work-life integration. So there's me, there's what I do at work. So there's work, there's home, then there's also me, myself, so that you're able to integrate all those aspects and have a fulfilling life. So when it comes to work-life integration, you need an equilibrium in all the roles that you play, whether it's professional, personal, and any other hat that you wear. Then with work-life integration, should be more of a realistic than a perfectionistic. Sometimes we look at people, our role models or other celebrities, and we're like, oh my God, and seem to have this perfect life, and we aspire to that. But what happens is, what is realistic for you in that space? And sometimes even with those people you're probably looking at, probably they show you the good side, they don't show you the downside. So we also have to have very realistic expectations of ourselves, knowing one important thing is knowing what your strengths are, what your weaknesses are, what you can manage, what you can't manage, what you can manage at that time. One weakness we have, and I'm also a very big I'm also in that category, is biting more than we can chew. And sometimes with medics, you end up, because of that empathy, you want to help and help and help. Sometimes you find yourself in trouble because you've really been giving your time, your effort, your, even talking to people, that is giving a lot of your emotional self to them as well. And you find you're biting too much than you can chew, and you're not able to rejuvenate back that energy that you've expensed. So your work-life expectations should be more realistic. Then you also need to know, or rather be aware of signs of mental distress or poor self-care, and know when to take a break. There's another thing where we are very guilty for. When was the last time you actually took leave? Many of us go for years and years and years and years before you actually take leave. Yet your employer knows. That is why it is set in your contract or whatever it is that you sign when you're starting work, that you're entitled to this number of leave days, because they know you need rest. But then many of us ignore that aspect, and we go for years and years on end without taking any form of break. And of course, that is poor self-care and can eventually lead us to burnout. Then, of course, with work-life integration, you need to look at the consequences on your productivity, whether it's in the relationships and at work. How's your morale, your general health? Then, of course, if you have to use alcohol and substances, other substances, drugs, that is, you also have to use it in moderation. Basically, at the end of the day, of importance is you need to have self-awareness, introspection, to know what you can handle, what you can't handle, when you're getting overboard or when you're still within normal, when you need a break, and when you can still continue, when you can still push. So the mental health friendly workplace, I think for any employers in the house, this would be very important for them to note, but also for you as the employee. So you need to know your working hours, take your breaks, take your leave whenever you need to. The employer needs to, give proper benefits and recognition of good work done, and have clear-cut roles and responsibilities for the employee, have clear reporting mechanisms so that it's very straightforward. This is what I expect you to do. This is who you report to, such that when you are underperforming, it's very clear as well. Even you, when you're told you are underperforming, it's very clear, rather than having this diffused roles that you're covering this ward and you're still covering this ward, but when you entered, you were to cover a certain ward, and then you're told, but this ward is also part of that ward. You see, so that's unclear space where now you find you're doing responsibilities or work for other people, not only what you signed up for. So workplace harassment, discrimination should also be avoided at the workplace. Counselors, where one can get help, is also very important. And also having team building days or distressing exercise days, at least once a year, is really recommended as well. So for any employers in the house or seniors who are in positions to do so, this is really also quite recommended. Because at the end of the day, employees will thrive when they're involved, when they are mentored, when they're challenged and positively challenged, when they're healthy, both physically and mentally, when they're paid well, when they're appreciated, when they're empowered, when they're trusted, when they're connected to strategy, and when especially they are hard and they feel hard. So before I finish, this is my last slide. It's always important to fill your cup. This is one thing we always forget as healthcare workers. You cannot fill someone else's cup if yours is empty. So you always need to always take care of yourself in as much as you're taking care of others. Sometimes you'll find yourself in situations, or some people are just generally in situations where people expect you to give and give and give and give. You're the giver in that space. It's very important for you as the giver to always remember that you need to fill your cup. Without a filled cup, there's no way you can fill anyone else's cup. You can't pour from an empty cup. So that is all. Thank you.
Thank you very much, Dr. Linda Nyamute, for that very timely discussion, especially right now where some of us are preparing for exams and also working on very strict deadlines that come with the training. So this is very timely. We appreciate that. So if you have any questions, please, you can raise your hand and ask, or you can post in the chat box. In the meantime, we have another psychiatrist in the call, Dr. Salma Mohammed. You can, if you are available, you can say something to add as we wait for the questions for Dr. Linda. Okay. Dr. Salma, are you in?
Yes, good morning.
Morning.
I'm not a psychiatrist, I'm a part 1 student.
Dr. Salma Mohammed. Okay.
Sorry.
No, apologies
sorry.
for that. It's because we also know there is a psychiatrist also with the same name, Salma Mohammed. So yeah, so apologies for that. We thought it was her on the call.
It's okay.
Okay, sorry about that. So any questions you have, you can post them in the chat box, or you can raise your hand and ask your questions.
There's a question.
Yeah, we have a question from Dr. Ngina. Briefly, a very informative session. Briefly, how can one deal with burnout?
So I think, as we said, the first important thing to note is the first step is actually knowing that you have burnout. That is really the first step to seeking help. Most of the time, what you'll find is if you have burnout, you've been diagnosed by the psychiatrist or physician, for example, it is a recognized disorder currently by the World Health Organization. So the first thing for me would be just take a break, because there's no way you'd still expect to be getting better if you're still in the same space that was causing you the same distress. So many a times it'd be that you take a full break. Sometimes it would be go slow, maybe on lighter duties, but in my opinion, just taking a full break, just pause, because whenever you get to burnout, it's your body's way, your brain and your physical body of telling you, I mean, this is enough. I need to rejuvenate. I need to, restart, to reboot. So in my opinion, just take a break first. Then while you are at that break, and in that space of away from the stress or the distress that is causing you to be in that burnout space, you could actually now come up with, why am I in this position in the first place? Well, how did I get here? Is it because that I've not created boundaries at work? Is it because that I'm biting too much than I can chew? Is it that this job is not what I set it out to be? Maybe my expectations were different from what I expected. And knowing what has brought you in that place will now help you know, how do I prevent myself from getting here again in future? So you now are able to plan. If it's I bite more than I chew, are you able to now have a work plan, for example? Are you able to probably say no? Sometimes many of us just don't know the concept of saying no. You know, you're asked, can you see this patient? Of course, okay. Can you help me with this assignment? Okay. Can you, you just yes, people pleaser to everything that is brought to your desk. Sometimes you find you have too much to do. So also learning how to say no and setting boundaries will help, but only you cannot be in a position to think or rather introspect in that aspect if you're still in the same environment that is causing you the same distress. So of course you need to pull back and take a step back.
There's a comment from Dr. Ashura. Thanks for the interesting presentation. It's an eye-opener. Most of us have experienced these challenges you have addressed. That's very true. There's Francis Were. We like taking leave to go and work elsewhere. Is change of environment therapeutic?
Change of environment will be therapeutic if it's still part of your work. But if you're taking leave, you need to take leave. There's no your body wouldn't understand, okay, so we were working there, now you're working here. Okay, fine, it may help you with like motivation because it's not the same sort of boring, if I may use that word, routine over and over. But if your body needs a break, it needs a break. It doesn't matter whether you're in Kajiado, whether you're in Nairobi, whether you're in Bomet, it doesn't matter. If your body needs a break, it does need a break. And many of us are very guilty for this, because what we do is you want to make, add a little more tunes here and there. But sometimes you collect so much money and then you collapse, you die, and you leave it for the people who will finish it in less than a week. So you also need to take care of yourself.
Maybe just to add on that, so like when I finished, I really wanted to make that money. So I was working left, right, and center. And it got to a point where I was just so tired, I was snappy, I was getting late to some of these locums. And I decided to step back. So I gave out most of these locums. But what I did now instead was I started studying a lot. So like I started doing courses, degrees, and all that. So even for myself, I kept on wondering why the burnout was never going away, why I wasn't feeling any kind of relief. And actually it was brought to my attention that I never really took a break. As in, it's like I changed from one thing to something else, but I really did not take a break. So the break is important because I would attribute it to changing environment. If you're still working, you're still working. So you need a break.
That's very true. I'd also compare it, unfortunately, I'll use this analogy, but allow me, to addiction. If you're addicted to alcohol, for example, and you are taking alcohol to the extent that it's really interfering with your life, then you stop taking alcohol, you've stopped, but then now you're taking benzodiazepine, okay? And then now you're addicted to benzodiazepine. Your addiction has still not gone away. You just stopped taking alcohol, but then now you have a new addiction here. So you'll be wondering why you're still not performing fully, but it's because you've just moved from one problem to another. It's still the same effect to your body. So yes, you need a full break, a total break.
Yeah, very interesting question from Jen. My God, thanks for the enlightening topic. Are you given sick offs by psychiatrists for burnout, or what do you mean by taking a break? That's very, because if you're a registrar, for example, just to add, and you're supposed to be at work, you're on duty, So you can't say I'm not going to work because I'm on duty or because I have burnout. What do you mean by taking a break? How do you go about it, especially in our setting as healthcare workers and especially as registrars?
Yeah, so we have personally, I have given very many sick offs for burnout, and not only for healthcare workers, but yes, we do give sick off. As I said, it's now officially a recognized illness by the WHO. So yes, you can get a sick off from the psychiatrist. I mean, when we say burnout, some people will even be checked. Some people just tell you check me in a mental institution, not because they have depression per se or a psychotic illness, but because they just want that break, and just be in that space where they are no longer, they no longer have to think about work. They no longer have to think about all these other pressures, probably even from home. Like they are completely exhausted. They just want a space where it's just zero. It's just me. Let me focus on myself. Let me, just deflate everything that has been going on and just focus on myself. So yes, when you say you take a break, it's a break.
Thank you very much. Any other question before we wind up? So there's this perception that sudden financial extravagance and reckless sexual indiscretion could be a sign of mental health issues. What is your comment on that?
Just repeat it. You read it a bit too fast.
Okay. Perception that sudden financial extravagance and reckless sexual indiscretion could be a sign of mental health issues. What is your comment on that?
Yes, of course. That's because that is an indication of poor judgment. And of course, if you're having poor judgment, then there's something definitely is off. It could also be isolated. If that's the only thing isolated, you'd want to know, why is this person having this reckless behavior? Because it probably didn't, because if it's sudden, they didn't have it before. So what is triggering it at the moment? Is it a way of responding to stress for them? Maybe there's death or something, or or is it some people get paid the first salary and they feel like, now I can go out there and the world will know me after the first salary and stuff. So is it just the personality because of probably that, the first payment, or is it because of a significant stressor that is going on in their life? Most of the time, there's usually a trigger, and it's important to look at that trigger and address it. But sometimes it could just be an indicator of some mental illnesses. For example, the illnesses which have high risk taking behavior, bipolar and ADHD. And of course, substance use. Yeah.
Okay, thank you very much.
Good morning. This is small input, a question. This is Amenge.
Yes.
Yes.
Is that okay? Thank you.
Yes.
Good morning. Thanks so much, Doc. Quite an insightful input. Two questions. So one, probably this employee, healthcare worker, colleague who probably has had a few things to deal with, and as a result has gone through psychotherapy. And often towards the end, there's the termination part. But then just before that part is completed, or on a follow-up after termination, the psychotherapy session, then we go back to the beginning, like a whole flash of the whole process happens, and we get incapacitated as if nothing had actually been done at all. So one, how do you handle such a person, both as either colleague, a partner, and two, from a professional point of view, would it be right to maybe consider another different professional take care of such a client or such a colleague? Or should the same person who was initially that person continue? It's one. And then number two, sometimes we may consider a senior probably not very approachable, or lack of a better word, toxic, or for various words that have been used. And you find either a worker, student, or a junior, upon seeing that particular senior, basically everything around him or her shuts down. However, the same senior has a very easy flow and relation and work relation with other juniors. And you start wondering whether is it that this senior is a trigger, a reminder to this particular junior who is being affected by his or her presence. In that case, what option does this junior who is being affected have? Especially where, of course, the hierarchy is, would it be necessary to have a direct conversation with this senior? Would it be necessary to consider probably having a higher person to have a discussion, or would it just need to go straight to a psychotherapeutic care? How does this junior handle this? And sometimes even the senior does not know, either from an experience that they had at the beginning of their first contact, and probably he or she forgot about it. But for the junior staff, for the junior colleague, it's a fresh reminder, and every now and then he sees that senior things are just out of control. How can that individual handle such a case? Thank you.
All right. I'll start with the first question. I hope I got it correctly. So when people are in therapy, but of course, again, it will depend why were they in therapy, whether it was it that they took themselves there, was it forced? Because many times when it's forced or coerced, they tend to drop out very easily. However, let's say they went by themselves. What you can do as a colleague or a family member, the first thing is not to give up on them. Sometimes, okay, we consider also mental illnesses the same way you'd not give up on your family member if they're going for their diabetic clinic, diabetic medication or hypertensive clinic. Then you found their BPs have been high or their sugars have been high, you will not give up on them. You'll still, what next plan of management. So the first thing is don't give up. Sometimes recovery is not a straight line. Not sometimes, most times, if not all times. It's not a straight linear curve that, we've moved from here, we moved from here. Sometimes it oscillates. You're getting better and then suddenly something happens, and that's another important thing. Is there anything that new that happened? Is there a new trigger that could have pushed them, that they were doing so well and then suddenly they are not? It's important to look at what could have been the genesis of this new change, because sometimes they could have probably some challenge at work, and probably that is what is bothering them. Or if it's a colleague, they probably have maybe a challenge at home. Maybe it's a lady, maybe the husband is hacking her every night with a muiko when he gets home drunk or something like that. I mean, you would find she's doing well and then suddenly things are not, or she's going through a divorce, or he's going through, child battles at the court or something like that. So it was also important to look at, aside from what you're seeing, this tunnel vision of what you're seeing, what else could be going on that could be triggering this whole new, we could call it relapse or setback. Yes, so should the same therapist continue? It will depend. It will depend on why they are, they have setback. If it's a therapy related issue, therapeutic, what you call the therapeutic relationship, if it's that the problem may be uncomfortable or there's something off with the therapeutic relationship, then you probably need a new therapist. If it's something totally unrelated to the therapist, as you said, it's maybe divorce or issues at home, you'd probably want them to still continue with the therapist, because starting over for a lot of patients, now you need someone new to start talking about, telling you all your experiences from scratch. It's usually a bit exhausting, and especially if you're getting along well with the other one. So they'll probably continue. On the issue to do with the senior versus the junior, I think in this aspect, you said the senior is not aware. So the problem here would be the junior. And if it's the senior seems to be getting along with other people, then the problem here could be the junior. So they need to look into back, introspect. I think that is the word for the day. You need to be very self-aware. Why am I feeling like this? Why did I behave? I mean, why am I still having these emotions? Sometimes it could have been the senior's fault, maybe how they approached. As we said, some seniors usually criticize with very hurtful words, with very, we used to have a senior who used to abuse us literally with abusive words, those ones that would be censored. Yeah, so if it's such, it's probably how they were approached, how they were criticized. But why the senior picked out on this junior alone, I mean, that would be quite interesting. But it would be important to look at why they feel so. Probably even the senior had a bad day that day. So sometimes looking at yourself and also understanding, sometimes maybe the problem could be you, the problem could sometimes maybe not be you. So what is within what you can change, what you can't change. So of course they need to, probably it's how they also respond to criticism. Maybe the senior talks to every junior like that, and the other juniors do not take it that offensively. But if it's someone who's been used to, and of course, what to talk about this new generation, we're used to this instant gratification, you're used to praise, you're used to, always excelling. And, when we walked into medical school the first time, you were told you're the cream of the cream, and, you feel like, you're on top of the world, and then suddenly someone comes and tells you what a bogus history, and you feel like, oh my God, they broke you. But probably it's also your personality that could be the problem, that, you're used to this praise. So whenever you get criticism, it also affects you. I mean, that case is a bit too broad to give any direction. Would the junior go directly to the senior? Again, it would depend. They can approach them directly. They can approach another colleague to help with the situation. How that would look to the other senior, I don't know. I think it will still depend. I think approaching them directly would be better, so that you also get their perspective. You'll find that senior does not even recall, probably don't even remember even your face or your name. So sometimes we carry grudges with people, or emotions from people of which they themselves don't even recall. So for me, I feel like it would be better to approach the senior and just let them know, probably I felt like this, or that is if they want to. Alternatively, if they feel that like they are the problem, then they can just go to a therapist, or go to another senior colleague other than that one, and just tell them, whenever I'm criticized, I feel such and such a way. How do I handle criticism, especially in this field where, I mean, anything small is criticized in a very negative manner? I feel like it's still a very broad case that needs a bit more details or nitty-gritties to be able to give a very decisive answer in management.
So maybe I can also comment, because it happened to be something that we were discussing yesterday. So there are various approaches. So you can either choose to be direct, indirect, do nothing about it, or to exit. So the direct approach would be to face the injustice head on. So it's either that person either just doesn't like you, because we know not everybody will like you, or it's just an outright injustice towards you specifically. So if it's something that you can actually quantify as a problem and find out the what, the how, the why, like you're able to quantify it's an issue, then you can be able to approach the person. If you feel you're not going to get anywhere with that person, then now you approach the senior to that person, someone to whom they're bound to listen to. Because a colleague, someone who's the same peer, most probably they will not get anywhere. So you need someone senior to that person. So that would be the indirect approach. Sometimes you have no choice. For example, let's say if it's med and you have to finish your program and then go away. So you might choose to just stay under the radar, avoid the person, like steer away and just only have the necessary contact, or you exit, you just bounce. Yeah.
Thank you very much.
I actually was in such a situation during my med. Actually, when you've talked about it, I've remembered. For me, I decided to ignore and do nothing about it, and I just finished. I was like, let me just get this over and done with. Yeah. But I think it will also depend on how much distress it's causing you at the end of the day.
There's some comments in the chat box. Michelle, thank you for this. We medical professions tend to put ourselves second, and I really hope we will reach a point where we make our health a priority. Mental health is a real problem. Debriefing is important, and I'd wish we'd have more platforms to aid with that. Jacinta Njagi, in our current situations, burnout is real. If you cover duties due to lost staffing levels with no support from other roles, what's your opinion or take on how to deal with this?
If you cover duties due to lost staffing with no support. If you cover duties due to staffing, no staffing. Okay. I don't know if that sentence is complete, but I think I'll just answer from how I understand it. If you cover duties due to low staffing levels with no support from other roles, I think where we're at as a nation, it's a very sad state, and we are at a position where there's a lot of lethargy from the staff because of understaffing. Even where I'm at, there's a lot of understaffing. So you find people are forced to duplicate their roles in terms of what they came in and what they're supposed to do and what they actually do on the ground. It becomes a bit of a challenge because some employers can be very mean, if I can use that word, such that if you do not fulfill the role that you've been given, they just easily replace you, But for those that you can actually go and probably converse with your senior or whoever it is that you report to, the management under which you are, and talk and say, I've been covering these duties. However, we need someone else to be covering this aspect. Some people create a crisis such that they cover what they're supposed to cover, and then this other work that was supposed to be done by someone else, they don't do it. How that will work with your employer will again can vary. So I wouldn't advocate for that in case someone does that and they lose their jobs. However, whenever you feel exhausted, I mean, you can always let your senior or whoever you report to know that, I am overwhelmed because I'm covering all these duties and I need a break. Sometimes they will not give you the break, and if you feel too overwhelmed, then you get the break through your leave. Or if you get so bad and you get burnout, you get depression, then you get a forced sick leave. Yeah.
Okay, so not seeing any further comments or questions in the chat box.
So maybe I can comment.
Yes.
It was interesting that you said that we all require some kind of optimum stress, that you also cannot have no stress or little stress or again excess stress, but there is that optimum stress that you need to function properly. So for me, that was a learning point. I actually thought you need no stress to be able to exist. But it was interesting to see that both sides of it have an issue, and that you can have poor mental health and you can have the extreme end of it, which is mental disorder. And maybe just to emphasize, just the same way you would emphasize on eating right, on exercising, it's also important that we also look at the mental aspect of things and to also treat it with the importance that it requires, because you need balance in body, mind, and so the mind part of it really has to be sorted out. And I just wanted also to emphasize again that it's important that we demystify the issue of mental health. It's not a bad thing. We exist with a physical body, we exist with a brain, with a mind. So really, it's not something that we can ignore. It's part of us, and we need to have to be healthy in the aspect of our mental aspect of life. So let's acknowledge, if you're feeling sad, acknowledge you're feeling sad. If you are feeling abnormally sad, it's okay that you're feeling sad. Acknowledge the emotion and find out why. What's the trigger? Why are you feeling that way? If you're angry, why am I feeling that way? So it's very important that you process the emotion. You look at the trigger, you look at the root cause of the problem. And normally the emotion is a sign of something that is happening. It's like to alert you to something that is happening around you, not as a bad thing, but so that you can actually sort it out, so that you can address the issue that is at hand. So we shouldn't take it as a negative thing. If it's your work, if it's your locum, if it's your friend, if it's your relative, whatever it is, so that you actually address the issue at hand. So the other thing I wanted to say was, don't let a stressor remain in your environment for long. It's very important to address it immediately, because the longer it stays, it morphs into something else. Because normally when these thought processes start, they start as just a mild thing, and then it's like a stone which is rolling down a mountain, and it slowly gets momentum. And it sometimes, okay, it should not get to a point where you cannot stop it, but it really gets momentum and becomes something else. So you want to nip it in the bud. For some people, you might find yourself in a very dark hole and you can't see how you can be able to dig yourself out of it. So it's important to reach out to other people. You can reach out to someone you trust, a friend. You can reach out to a professional. Some people don't want people to know their business, so you can reach out to someone who doesn't know anything about you. And this is where Dr. Nyamute comes in. So you can actually reach out to other people and talk. The other thing, Dr. Nyamute was calling it spiritualism or religion. It's actually very important to ascribe to a higher power if it's something you believe in, because you are able to cast the issue to somebody else, cast your burdens unto me and I shall give you rest. So essentially you're able to transfer the issue to someone who's able to handle it. Personally, I believe that actually does get handled. So it's not just a matter of transferring emotion, but truly it does get handled. So it's important to have that aspect of being able to release whatever pent-up pressure you might be having inside. On the issue of burnout, this I'm saying because it's got something I've experienced. So having come out of it, I'm very careful and I'm very keen, and I'm able to sense when I'm pushing myself too much. So it's okay to push yourself. It's okay to look for that money and to do whatever you need to do, but be sensitive to your body. Do not compare yourself to somebody else who can work extreme hours, or you might be that person actually who is able to work extreme hours, but listen to your body. So just gauge, and it's like pressing on a pedal and you're trying to build balance. So just listen to your body and be sensitive to it. Because I remember there was a time I started feeling that the burnout again. So I went to Mount Meru. So while I was there, I was very relaxed. Everything was okay. It's like you've left the world behind you. But it's like immediately I came back the very next day. It's like I carried whatever load I had left. It's like I continued from where I was. So it's like the break didn't really help. So at that point, I acknowledged the stressor. It was a particular thing I was engaging in, an activity. So I left that job. So it's a sacrifice. So you choose to walk away. So that's an example of something that I chose to walk away just for my own mental well-being. So some of these things you choose. Some things you can do without, some things you can't do without. So it's important to realize that you can walk away from some things. And then on the issue of the consoles, there's this culture that we have that we don't really interact with each other. So I remember there was this time I was at a workshop in Mombasa, and I had my name called out in a very cheery way, Dr. Onyeki, and I turn around, it's a console. And you feel like you want to bow down, like almost your head touching your ankles. And the person was so easy. And I'm like, you could not relate to the person you interact with in Kenyatta, to this person in a kind of relaxed environment, but you're not able to connect with that person. But the guy was easy, he was in shorts, he was swimming, like he'd found a way to disconnect himself from the stress around KNH. So even just for us, it's important to have spaces where truly you disconnect from, because sometimes you cannot avoid the stressful, in quotes, environments. So you find a way to detach yourself and just to unwind. It's very important. And I hope that helps someone. I hope the whole session helps somebody. And also, Dr. Nyamute, if you would like to add more remarks, this is like extremely important to all of us. Thank you.
Thank you. I think I'm also grateful for the opportunity. I think we can emphasize further. Many times when you tell people mental health, they think mental health is a reserve for some people. But what we say is mental health, we all have mental health. The same way we all have sugar, blood sugar, we all have blood cholesterol, we all have blood pressure. Only that some people will have high blood pressure, some people will have low blood pressure, etc. So it's the same thing. We all have mental health. Only that some people will have good mental health, some people will have poor mental health, some people will have mental disorders. So sometimes we tend to think that mental health is a reserve for those guys in Madare and the psychiatrist and the psychologist, but that's far from the truth. And the more we embrace our mental health, the better productive we'd be as individuals. So yes, these conversations, I think, need to be had more and more often. And whenever you feel in distress, it's always important to just take a step back, have a meeting with yourself, and then if it's not working, you can talk to someone else. If it's a friend, a colleague, a family member, if that's not working or that doesn't feel like a safe space, you can always seek help from a profession. Yeah, I think that's it for me.
Okay, so I want to appreciate everyone for waking up very early to attend this meeting. And my heartfelt thanks to Dr. Linda Nyamute for availing yourself to be our speaker for the day on this very important topic that affects all of us. So, Dr. Diana, don't know if we can end the meeting.
Yes, we can.
Okay, thank you, everyone. Let's meet next time.